We told you yesterday how the flu had reached emergency level in New York State. And today, many Western New Yorkers are taking action to protect themselves and their family from getting sick. News 4's Rachel Kingston joins us now with more on the fight against the flu. Rachel.
The VNA opened its doors for a somewhat impromptu flu clinic earlier today. We went there and we found a great number of the people who were taking advantage of it were parents and their kids. Catherine Ruin brought her 10-year-old son Eric to receive a flu vaccine.
I think it's the right thing to do as a parent to help them be protected. You know, it only makes sense if they're available.
Jeffrey Pittner's kids get the flu shot every year, and this year is no different.
Pretty much to make sure that they stay healthy. That's the key, and that they don't get the flu and give it to any of us. You know, at school, when they're at school during the day, you know, kids, it's a germ fest at school, and they pass, you know, germs to each other.
More than 19,000 people across New York are reported to have gotten the flu so far this season, compared to 4,400 all last year. Governor Cuomo's declaration of a public health emergency on Saturday now allows pharmacists to vaccinate children younger than 18. Many of the patients immunized at this flu clinic, sponsored by the Visiting Nursing Association, were kids.
We're not planning on having one, but just in response to the reports of the widespread flu activity, I added on today, and we've had a good response. The calls that I've been getting, the pediatricians are running out of vaccine, and that's why we're getting probably more kids than usual.
Flu shots are about 60 to 70% effective, so they're not an absolute guarantee that your child won't get the flu. Some have even wondered about the safety of the dormant virus cells and other components in the vaccine.
Ever had any issues with the flu shot before?
No, none at all. None at all. I think that's a fallacy. I don't think you can get sick by getting the flu shot. At least that's what I'm told.
According to the CDC, there are some people who should not have the flu vaccine, including those who are allergic to chicken eggs, infants under 6 months old, anyone who's previously had a severe reaction to the flu shot, and people who are ill right now, especially if you have a fever. If you do decide you want the vaccine, you will find a list very shortly of the upcoming clinics in this story on WIVB.com. Live, Rachel Kingston, News 4.